you wear two hats simultaneously because you're a peritoneal dialysis nurse, right? So for all of our viewers that aren't acquainted with what PD, can you explain what's meant by being on PD and a PD nurse?
So peritoneal dialysis, or PD, is the type of dialysis where we use a sugar-based fluid, so usually dextrose, and the sugar is, this fluid is placed in the abdomen through a tube that's surgically placed. What I do is I teach people how to exchange out the old fluid, replace the new. So the idea is they put in this nice fresh fluid, it sits in their abdomen up against this peritoneal membrane, and it helps to pull the waste and extra water, potassium out of the blood. And then a few hours later, whatever has been decided with the team, they connect again, they drain out the old fluid with the waste, refresh with new fluid. That would be manually, or the alternate way of doing it is with a cycler or a machine that they connect to every night, and the machine drains and refills them and then lets it dwell, drains, refills, dwells, multiple times while they sleep. And so it's a way of cleaning the blood in a different way rather than the kidneys, because by the time someone needs dialysis, their kidneys aren't filtering properly. Might be filtering water, but maybe very little waste, or a little bit of waste and very little water. It just depends on each individual. So my job as a PD nurse is to teach people how to do the treatment itself and how to prevent infections, what to do if there's a problem, who to call if there is a problem, and then supporting people throughout that journey. So usually we set them free when they're all educated, and we check in with them at clinics with their doctor and the whole team, and we're there for them if they have questions in between or problems. And we do a lot of problem solving over the phone, actually, because PD nurses cover quite a large area, right? So patients might be live hours away from their unit, so we do a lot of problem solving over the phone.
So for a patient, a CKD patient that's really just beginning their journey, they've been diagnosed with kidney disease, right? How would they get to be on peritoneal dialysis?
So usually that conversation starts with their nephrologist in their office or in the kidney care team, if that's where they're coming from. So they will have usually an options class in our area anyway. I can't speak for every area, but typically they would be notified of all the possible options that they have and what goes into that. So they would be notified of peritoneal dialysis if it's an appropriate choice for them, hemodialysis or transplant, or sometimes conservative care. So there's lots of the variety of options based on the individual situation. Peritoneal dialysis is great for a lot of reasons, but there's always reasons why it's not good for everyone. Same with hemodialysis, same with transplant. So they go over all the possibilities, and if at that end they decide, you know what, this person might be really good with peritoneal dialysis, or they're interested and they want to know more, then they would get referred over to us at the clinic, and we would meet with them and do an orientation. We show them the equipment, we go over, this is what you can expect, this is what you would see in the home, these are the types of appointments, this is the training you would get. So we give them a broad picture of everything, or as much as we can, that they would be experiencing if they were to end up on peritoneal dialysis at some point. So we try to see them early. I don't want to wait until someone needs it now, because there's a lot of pre-planning that happens, and no one likes to be shocked and thrown in. So we try to see people while they're still feeling relatively well before we get there. We try to see people before they need it, so it's not a panic.